Remote patient monitoring helps health systems in a couple of ways. The most important is it establishes a very strong bond between them and their patients on a continuous basis. Patients have choice in most geographic areas. They have 2 or 3 providers they can choose from. Someone who's being cared for continuously in their home by their provider is very likely to always come back to that same provider.
Providers, very typically in their worlds, have spent their time inside the clinic walls, inside the hospital walls. Traditionally, remote patient management really is being seen to benefit the providers in that they're getting better information. They get more information, and sometimes that can be uncomfortable for them because either they're not sure what to do with all the information, or, not to sound harsh, but they're not being reimbursed to spend their time dealing with this information. And so it makes that model a little bit more difficult.
Further, many health systems carry risk. That could be through an ACO, it could be through bundled payment structure, it could also be through a captive health plan. And in those environments, it saves cost for the health system, which increases their operating margin.
So what we found from the provider base is that, they really started out being basically told, we're going to penalize you financially if your patients get readmitted to the hospital within 30 days. And the physicians, the providers, had no idea what they could do or how they could do it to sort of help mitigate that risk. It could be as simple as, give me the names of the patients that are being discharged, and we will get them into our safety net, and we will make sure that you get the information you need so that they don't get readmitted to the hospital within that window. That's how remote patient management models are really benefiting the providers today. It's actually a solution that they can engage with to help manage those patients after discharge and ensure that they are getting the good quality clinical and low-cost care that they deserve, and the physicians, the providers, are no longer being penalized.